Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Antrochoanal polyp. So what will be the main etiological agent? It is going to be infections. So it may be due to infections as well as the allergies. And usually whom does it affect? It affects the children. The state of origin is the mucosa of the maxillary antrum. So it involves the mucosa of the maxillary antrum. Now, what is the clinical features? The CF clinical features is it is usually single and unilateral. So, clinical feature is it is single as well as it is unilateral. Then, the unilateral nasal obstruction is seen. So, the unilateral nasal obstruction, it becomes bilateral. So, unilateral nasal obstruction, it becomes bilateral when it grows posteriorly. And it obstructs the opposite choana. And what does it does? It obstructs the opposite choana. Next is the mucoid nasal discharge. So mucoid nasal discharge as well as the hyponasal voice. So to recap, it is single and unilateral. It grows posteriorly and obstructs the opposite choana. And there is a mucoid nasal discharge. This is all in antrochoanal polyp. And there can be hyponasal voice. Hyponasal voice is also seen in antrochoanal polyp. Now, what are the findings we see? The finding is that it grows posteriorly. So it will grow posteriorly. And it is usually missed on anterior rhinoscopy. Anterior rhinoscopy is usually, you won't find any positive findings, so it can be usually missed. Next, when you look at the posterior rhinoscopy, the posterior rhinoscopy, it becomes, there's a globular mass filling in the choana or the nasopharynx. So there's a globular. So there will be a globular mass filling. So globular mass filling the choana. So globular mass which fills the choana. So it fills the choana as well as a NP, that is a nasopharynx. Next is we have the investigations. So what will be the investigations? Investigation is that it includes the nasal endoscopy. So nasal endoscopy, it will show the nasal polyps that are pale. So it will show the polyps and they are pale, they are gelatinous as well as pedunculated. So next is the non-contrast CT, NCCT. NCCT scan, it gives executive bone details. So it gives the bone material details of the PNS, bone material of the PNS anatomy. And it is a primary diagnostic image modality. So it is a primary imaging modality. And how is the treatment? The treatment of the antrochoanal polyp is going to be FESS. To learn and grow daily like this, please do subscribe.